Hi, my name is Vicky and I'm a speech and language therapist, and today I thought we could have a chat about terminology relating to speech and language therapy. We're going to have a talk about terms that you might hear your therapists use or your schools use, and also terms that you might see in reports or terms that you could use when you are talking to a health professional like a health visitor or a pediatrician, and so on and so forth. So let's start with job titles. A speech and language therapist is a person who supports children and adults who have speech, language, and communication needs, and some specialist therapists also do work in swallowing. So these therapists usually work in the adult community services or in hospitals, and they can also work with feeding difficulties and swallowing difficulties in children and infants. A speech and language therapist is often called many things. It's a bit of a mouthful of a title. So sometimes you might hear them referred to as speech therapist, language therapist, SLT, SALT or assault. And in some parts of the world, you may also hear them referred to as a speech and language pathologist or a speech pathologist. These all refer to the same kind of professional. Most of these professionals will have training at university level, so they might have a bachelor's or a master's degree in speech and language therapy or speech pathology or speech sciences. And they are usually recognized by an accredited body. So if you would like to seek out a registered professional, you can look up the accreditation body for allied health professionals in your country, if there is one, and see if your therapist is registered. Most therapists will state if they are registered with the accreditation bodies that allow them to use the professional titles of speech and language therapist or speech and language pathologist in their home countries. So in speech therapy, you may often hear therapists or people who are working with those therapists, like teachers, use different terms that you may find a little confusing. Because those terms can mean very broad things in general daily life or conversation. So let's start with some of the things that speech and language therapists often look at. We often look at attention and listening skills. And what we mean by the term attention and listening skills is the child's ability to attend for an age-appropriate amount of time, for them to be able to control that attention, because attention development happens in stages, and for them also to be able to use that attention to actively process, pay attention to and process the information that they're receiving, be that verbal information, so listening, or visual information, and information that they read, for example, could be visual information. So that's attention and listening, and how long they can attend to, or how long an instruction they can attend to, for example, or how long they can stay on the same task without help. Another term that you may hear therapists use, would be receptive language and expressive language. So these are often used in our reports, and we also use it to be very specific in what part of language we're talking about. So receptive language refers to understanding. It is how much a child can process and understand of what is being said to them. So for example, we often assess a child's ability to understand and follow instructions of specific lengths, instructions that include a range of concepts. So that's a form of receptive language or understanding. We may assess a child's ability to understand questions like why, who, did what, where, when, why. That's a form of understanding. And we may also assess a child's ability to understand a short story or age-appropriate story level, and then be able to answer questions relating to that. And then when we talk about expressive language, this is where we are referring to the child's ability to use language. So not necessarily use it to communicate, but to use language. So can they use words? Can they use phrases? Can they use sentences? What is their grammar structure like in their expressive language? And what can they say? Can they tell stories? Can they plan narratives? So those are some of the things that are included in expressive language skills. And then we move on to terms like speech. Now, speech in layman's terms in the general world can mean lots of different things. So often families may refer to speech, or my child has no speech, as the child has very little expressive language. But when a speech and language therapist uses the term speech, we tend to refer to pronunciation. So the child's ability to use all the sounds that they're supposed to have in their language, the language that they're using, and this is different in every language, and whether or not they have developed the appropriate sounds at the appropriate ages. So, for example, if a child who is maybe about 8 years old still produces the R sound like rabbit as W, as in wabbit, then we will say that there is a speech sound delay in which they have not yet acquired, or they are still maintaining some articulation processes that are not typical for their age. So they're expected to already have acquired the R sound by the age of 8. So that's what we mean when we say speech or speech sound difficulties. We don't mean the expressive language skills or the child's ability to use language to communicate. We refer to their actual pronunciation skills. And then on top of that, there's also fluency, which we sometimes refer to. And fluency of speech refers to how smoothly a child or a person speaks. So, for example, if a child has a stammer or a stutter, the fluency of their speech will be affected. So how smoothly they can say something without being interrupted or affected by the stutter. So that is also something that therapists assess for, watch out for, and then work on. Now, there is also a subset of therapists who may specialize in voice difficulties. They typically work with ear, nose, and throat specialists, ENT specialists, and they support in the use of voice. So as in things like, does your voice sound hoarse? Does it sound like it's affected by something? Or is there intervention that's required so that someone doesn't have like a really hoarse voice problem or a different voice quality than what would be typically considered normal? So there are therapists who work on that as well. So those are some of the terms that you may hear frequently in just general day-to-day speech and language therapy. You may see them in reports. Usually they're explained in reports, or you may hear teachers, your therapist referring to them offhand. So I hope that this helps explain what some of those terms mean. Thank you.